This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hello and welcome. Thank you for joining us today. This is Kiran Thakur from Columbia University Irving Medical Center, New York Presbyterian Hospital. And I'm so excited to be joined here with Ava Easton, a close friend and colleague who is the Chief Executive of Encephalitis International, to discuss the global World Health Organization technical brief on encephalitis. Ava is a researcher and global expert on encephalitis outcomes and quality of life. Welcome, Ava.
Thank you so much for having me on the podcast.
I first want to start by asking what a WHO technical document and report is. What does that mean for those of us who are unfamiliar with this public health work?
Technical briefs are short, focused documents that summarize evidence, guidance, and recommendations across a range of areas, such as everything around a disease, from prevention and surveillance through to perhaps diagnosis, treatment, and rehabilitation. And they've got a really wide audience. They're aimed at a range of people, such as policymakers, public health professionals and planners, as well as researchers themselves. And Encephalitis International has been saying for many years that encephalitis matters. But this was the first time that the WHO said encephalitis matters. So this is a huge lever for change and also for research funding to address some of the issues that the technical brief and our global report, which preceded it, had identified. So for me, it's a really exciting document.
With some of the points that you've made, can you speak to your work involved in Encephalitis International? And then talk a little bit about the journey of how this encephalitis technical brief came to fruition at the WHO.
My work personally as chief executive is very varied. It's everything from academic writing through to raising money, through to leading my team, with no day really is ever the same. It was February 2020, we delivered a petition to the WHO signed by people from 128 countries, along with a short report explaining why encephalitis matters. And I was accompanied with a good friend of mine and colleague that you know, Professor Tom Solomon. Behind the scenes, we were actually working on what we call a full baseline situation and gap analysis. For short, we call it our global report. And this was really looking at everything that we knew about encephalitis, from surveillance through to treatment, through to prevention. And we presented this to the WHO in 2021. And we were absolutely thrilled when we heard back from them, and they said that they wanted to continue discussions. So some months later, what followed was a 2-day stakeholder meeting, after which the WHO published a report called Why Encephalitis Matters. Now, this was a first wow moment for us. As I mentioned earlier, we'd been saying for decades that encephalitis matters. So this was a real seminal moment because, as I said, it was the first time that the WHO had said that encephalitis matters. And the report was published to coincide with World Encephalitis Day 2023, which we were equally thrilled about since that's an awareness-raising day, a global campaign that's led by Encephalitis International. And then more meetings occurred, and in short, we agreed to fund this technical brief written by the WHO, and that was published in February earlier this year, 2025, to coincide again with World Encephalitis Day.
Can you describe some of the main conclusions of the report by WHO on encephalitis? And I think to your point about why encephalitis matters, which is a kind of theme throughout this work and what you've done for the last several decades, how this really speaks to that theme that has developed in the work that is involved in Encephalitis International.
The main conclusion of the technical brief is actually quite bold. Encephalitis is an increasing global threat with an urgent public health imperative and represents a significant yet under-recognised global health challenge. Really bold. And it states clearly that there's substantial mortality or death rates, substantial disability attached to this condition, and also it touches upon the economic impact. It also reminds us that trends of emerging and re-emerging viral outbreaks of encephalitis are increasing, and that the identification and recognition of autoantibodies are contributing to the growing number of autoimmune encephalitis cases. So this is back to the significance again. It's the first time that a document on encephalitis has been coordinated by a global health leader like the WHO. The significance of the technical brief for us is very much that we are now developing an interim international action plan to try and take forward some of the recommendations that have been made by the technical brief. It also really links into a lot of other work that we're already underway with. So currently doing global training platforms, for example, particularly aimed at low to middle income countries, and developing our conference, the Encephalitis Conference in December every year, which attracts this wide audience. So we're doing a lot of work such as that, where we can use those things that we're already doing as conduits to start conversations and start having discussions around what some of the actions are that we can take to drive forward some of the work of the technical brief. So I think that there's going to be a lot going on, and I really see Encephalitis International as being a leading part of those conversations.
Can you speak to a little bit about the work and partnership that you have been doing with the American Academy of Neurology and its membership on encephalitis?
We have a great relationship with the American Academy of Neurology, which has been increasing over the years. We attend the annual conference every year and also the biennial autoimmune-focused conference. And we had a stand last year at the annual conference, which was really cool. And we also financially support the American Brain Foundation with research funding, most recently their neuroinflammation initiative, which also included encephalitis. And now here I am doing a podcast with you.
The highlight, of course. Can you talk a little bit about maybe a patient or caretaker story that influenced the work in the report, and also speak to how you think the report may impact encephalitis survivors and caregivers?
There were a lot of people with lived experience who contributed to the technical brief. And Encephalitis International also brought a lot of representation of the patient voices. And in terms of stories that have influenced my work and that have influenced things like the technical brief, I guess there's probably two that jump into my mind immediately. The first one was really something that influenced me deeply personally. When I first started work, I haven't always been the chief executive of Encephalitis International. And originally, over 25 years ago, I was actually working for the organisation, but directly supporting patients and caregivers. I remember one of the first cases that was referred to me. It was a woman, I was told, who had severe memory problems, experiencing seizures, post-herpes simplex encephalitis. And I got to know the family. She didn't just have memory problems. What she had was a 10-year black hole, effectively. And just before she became ill, she'd had triplets, 2 boys and a girl. And she couldn't remember giving birth to her children. But she also couldn't remember that the 2 boys died. And I'm getting goosebumps now even talking to you about it. And it was something that really deeply touched me. And that's not an isolated story. These stories are why I'm still here and why I'm still doing the work that I do on behalf of patients and caregivers. To give you another example, there was a colleague of mine, Dr. Rita Mani, who is in India. She wrote an article about a couple. She described them, I think, barefoot and in tattered clothes, walking into emergency services at somewhere that we call NIMANS, which stands for the National Institute of Mental Health and Neurosciences. And that's a public hospital, a public neurocare hospital in Bangalore in India. And she describes in this article this woman holding a sick child in her arms and a male companion with them, and they had 2 more children in tow. Now, the child was diagnosed with rabies and encephalitis and died within a couple of hours, but there was nobody to claim the child's body because the parents had left the hospital and they couldn't be traced, and the body lay unclaimed for several weeks before it was cremated by the police. Now, this wasn't because they didn't care about their child, but it was because, as Dr. Mani wrote, it was because the cost of cremating a dead child could be better used to feed their other children. And that was another story that really stuck with me. And this is the harsh reality faced by many parents, not just in India, but in countries all over the world, especially low to middle income countries. And so for me, it was another story that stuck with me. And so those are the types of a whole range of stories that have influenced our work at Encephalitis International, but also influenced the reports that we wrote and the things that have fed into the technical brief. And the WHO were very serious about the inclusion of lived experience in the production of the technical report.
Those stories are striking. I know all of us have many patient stories that stick with us in terms of our minds and shape the work that we do. And one of the things that I've learned a lot from you, Ava, and the organization is the importance of having patients and lived experiences, caretakers at the table with policy decisions, with development of research ideas and collaborations and clinical care practices. So thank you, because you've had a huge influence on many of us. And I know AAN also does a huge amount of work around patient advocacy. And it's exciting to see that we have individuals with lived experiences that are more and more involved in shaping our research, our policy, what we do at the bedside. I think fundamental to all fields of neurology. In that vein, there's many individuals listening on, neurologists, nurses, other care providers, some individuals with lived experiences who may study encephalitis, may study other neurological conditions which have parallel impacts. And they may be curious in terms of how they can become more involved in this type of work. And I wanted to ask you what your advice would be in terms of how they can be more involved in advocacy efforts and policy development, and how you could talk to our broad audience about pathways for that in terms of maybe other neurological specialties as well.
Absolutely. And we want people to get involved because quite simply, people are dying of this condition around the world and being left with effectively needless disabilities. And of course, as some people will know, some causes of encephalitis are preventable. Other causes are being misdiagnosed, or we're seeing delays in diagnosis and treatment. And so it's so important. And so there's lots of ways that people can get involved. Get in touch with Encephalitis International. We've got a fantastic brochure on our website called Collaborations and Partnership in Research. And that's all about how we can help people in their research, in their professional work, and also how we can help their patients and the carers of those patients. Professional membership with Encephalitis International is free and opens up a whole world of opportunities for interested professionals. Everything from when our grants open through to getting involved with World Encephalitis Day. The technical brief raises the issue that raising awareness of this condition is critical. And World Encephalitis Day is the one day of the year, probably lasts actually a couple of weeks really, but we call it a day where people can come and get involved. People can speak at our patient events, part of a collaboration between Encephalitis International and Columbia in New York. And I heard this morning that the event has sold out. Not that we sell tickets, we don't, but it's fully booked. So people can get involved. Many of your colleagues are coming to speak at this event, educating patients and caregivers. And I know that you and we all learn as much equally from hearing their stories on those days. And as I mentioned earlier, people can be part of what's effectively the go-to encephalitis conference in December every year, which in 2024 saw over 500 delegates from over 70 countries. We also offer over 200 free places every year to people from low to middle income countries at that conference. Getting involved with whatever profession people might be, neurology or professions allied to neurology, getting involved is something that people can do to help us make a difference and to help us really mobilise the actions that this technical brief talks about.
And I know the huge amount of work that you and your organization is doing on behalf of encephalitis, and AAN has recently highlighted their Brain Health Summit, which is also doing a huge amount of work and bringing together stakeholders in advocacy efforts across neurological disorders, which we know are frequently under-recognized and stigmatized. So huge amounts of work to be done, both locally and internationally. What are the next steps from this report? How do we really turn policy? How do we turn this document into action? And what are your next directions, Ava, on behalf of this document?
I think I've touched upon some. Obviously, we're going to continue our collaboration with the WHO, with the World Health Organization. It's uncertain times at the moment because they're undergoing a significant restructure. We're just sitting on the sidelines for things to settle down, and then we'll continue conversations. We have an action plan that we have now developed based on the recommendations in the technical brief. We've already started to progress some of those, and one of them has already come to fruition. So recently, it was last week, the WHO released their 2025 version of their essential medicines list. Through collaborative work with the WHO, we've managed to get acyclovir and valacyclovir IV recognised for central nervous system infections, which it wasn't before. So exciting things already happening. I think I mentioned earlier as well that we are working on currently and hope to release before the end of this year a global training platform which is aimed at low to middle income countries on diagnosis and treatment. And that's something that we're hoping on a rolling programme we will add to. We are focusing on two of the key actions in the WHO technical brief under surveillance and prevention and research and innovation for our seed funding call this year. So that's grant seed funding that Encephalitis International gives out. And so we're focusing on attracting applications under both of those areas from South and Central America, working to expand the encephalitis conference, as I mentioned earlier. So most importantly, probably going into 2026, is our capacity and ability to bring together people for conversations. There's going to be a lot more of that. The WHO can't do this work on their own. We can't do it on our own. I don't think many people can achieve some of the huge structural change that's needed to address some of the things. So it's going to be about collaboration. And I very much see us as a conduit towards that. But right now we have this interim global action plan. We've taken every section of the technical brief, and over the next 2 to 3 years, hope that we can start doing some of that work, and where we can't do some of that work, have conversations with the right people about how we can bring to life those recommendations in the technical brief.
Thank you so much, Ava. I think some of the words that stuck with me when you were speaking is around collaboration and around bringing this work to life. And I look forward to being involved in this. And I think you've inspired, hopefully, many neurologists, including our trainees, to really have this work and advocacy and policy development as part of their career. It's so foundational for the future of neurological disorders broadly. So thank you very much for educating us and talking to us today about the WHO technical brief and all that you do for encephalitis and Encephalitis International. Thank you so much.
Thank you, Kiran.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology Podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes. Or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.